everyone, welcome back to Vanakkam, Germany, your go-to channel for understanding life and finances in Germany. Today, we are unpacking important healthcare updates for the year 2025 that you need to know, from maintaining patient records to health insurance premium and so on. If you are new to this channel, myself Priya, I make videos all about life in Germany. I also provide one-to-one consultation on different topics like insurance, investment, personal loan, house loan and so on. Feel free to book an appointment with the link given in the description. If you are ready, come let's get started. Coming to the first update, electronic patient record. The electronic patient record EPA will officially launch on January 15, 2025, starting in pilot regions like Hamburg, Franconia and some parts of NRW. After 4 to 6 weeks of trial phase, it is expected to roll out nationwide by March 2025 or later. So, what is exactly EPA? Every public health insurance companies must offer their insured person an electronic patient record. This is something like digital record for the patients. Doctors use this to document the patient's medical history in their system, like vaccination report, doctor letters and so on. So, what are the key features of the EPA? Automatically created for a public health insurance members under opt-out principle. It means if you don't want to have the data stored digitally, you can inform insurance providers about it. Generally, it stores essential health data such as doctor's notes, surgery report, discharge letters, and images like X-ray, MRI, and so on. It includes an electronic medication list that tracks prescribed medication. Patients can upload personal medical documents like old reports, and this will be helpful for the doctors to check out your entire history. In case of emergency, doctor can see this record digitally and track all the important informations to the patient in the faster glance. In the future, the EPA will expand to include digital vaccination records, dental bonus booklets, and children's and maternity health records, something like this. Managing your EPA, it's very simple. To access your EPA, download your insurance provider EPA app, where you can find the details about your medical history. You can manage documents like adding the documents, hiding the documents, or delete some documents if you want. You can also adjust the access duration, which default to 90 days for the clinic and doctors and 3 days for the pharmacists. Coming to the privacy part, access is logged and the medical facilities can only view the data if needed for the treatment. This initiative aims to simplify healthcare management while giving you a control over your health data. In my opinion, this is very useful and necessary while living in Germany. In the past, you don't get to see what all the details recorded in your documents and how your issue was diagnosed. With the EPA, you can have them in handy and use it in the future for any diagnosis. It's very smoother way. If you're starting business in Germany, you need to open a bank account and you need some insurances to protect your business. So if you are wondering which is the best option, you can also use our comparison calculator in our website, where you can check with all the providers and you can choose the best which suits you. Next update is about the health insurance contribution. Starting January 2025, the average additional contribution rate for public health insurance will increase by 0.8%, reaching 2.5%. Each insurance provider will decide how much to raise the rate. So, what does this mean for you? The contribution assessment limit for health insurance will increase from 5,175 euros to 5,512 euro 50 cents per month. The general contribution rate is 14.6% with the average additional contribution Zusatzbeitrag of around 1.7%, which varies between each providers. You can find out this with your public health insurance providers. Now, the maximum contribution you pay will rise from 843 euro 52 cents to 898 euro 53 cents per month, which is roughly you will pay around 55 euro more per month or 660 euro per year. Again, your employer will pay half of this. If you are self-employed, you will cover the full amount by yourself. If your insurance provider raises its contribution, you can switch to another health insurance company using special rights of termination. If the new rate starts on January 1, you can cancel until January 31st. The new insurance company will handle the cancellation process for you, but make sure to choose your new provider on time. Keep in mind there is a 2-month notice period to end the contract. You will need to pay the increased rate until your switch got finalized. You can compare all health insurance providers on Vanakkam Germany website. You can choose the best one based on your needs. The link for the website is given in the description. Make sure to stay informed and choose the best option that suits you. If you are looking for private health insurance provider, feel free to book an appointment with us. Our consultants will help you to get the best one. The link for the appointment is also given in the description. Next update is about dental filling. Starting from January 1st, 2025, there is a major update in dental care across EU. The amalgam filling will no longer be allowed for new dental treatments. Why this sudden change? It's a part of the international effort to reduce mercury in the environment. Let's break it down. As a replacement for amalgam, public health insurance will now cover self-adhesive materials like tooth-colored composites for molar filling without any additional cost. These materials are applied in layers and have been used since 2018. But there are few exceptions. Amalgam can still be used if the dentist thinks it's medically necessary. And don't worry if you already have amalgam filling, they are considered safe. Wondering what amalgam is? It is a material made of mercury mixed with metals like silver, tin, and copper used to fill cavities caused by tooth decay. Next update is about the nursing care insurance. Starting January 1, 2025, nursing care insurance contribution in Germany will increase by 0.2% points. These changes ensures the financial stability of the nursing care system. Now, coming to the contribution rates. 3.6% for insured individuals with children, 4.2% for those without children. Families with more children pay less amount, with rate ranges from 3.6% for one child to 2.6% for 5 or more child. This adjustment was decided by the government in November 2024. So these are the very important updates and changes coming in the year 2025. I hope you like this video, and if you find this video is useful, please do subscribe this channel and share this video to your friends. I will see you in yet another interesting video. Until bye bye from Vanakkam Germany, Priya.